Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every episode of weakness or dizziness is a real story, and today's topic highlights something many young women experience quietly for months before realizing how much it is affecting the body. Anemia. Because anemia does not always begin dramatically, often it begins as just tiredness. And over time, the body slowly struggles to keep up. That is why we approach it from four perspectives: what the doctor evaluates, what the pharmacist safeguards, what the dietitian supports, and what you at home can recognize early and respond to properly. This is your nursing perspective. In real life, there is a pattern anemia often follows. It usually starts quietly. You feel tired more easily. Simple tasks feel heavier. Climbing stairs becomes exhausting. You stand up quickly and feel dizzy briefly. At first, it seems explainable. Maybe I'm stressed. Maybe I haven't rested enough. Maybe I'm overworking. And for a while, the symptoms come and go. But slowly, the pattern deepens. The fatigue lasts longer. The headaches become more frequent. Concentration becomes harder. The heart starts beating faster with small activity. Then daily life begins to change. Exercise feels difficult. Energy drops earlier in the day. Recovery feels slower. At that point, it is no longer just ordinary tiredness. It is a pattern. And from a nursing and home care perspective, the first step is simple. Observe before you react. Pay attention to frequent fatigue, dizziness or lightheadedness, headaches, palpitations or rapid heartbeat, shortness of breath during activity, poor stamina, pale skin, lips or inner eyelids, difficulty concentrating, heavy menstrual bleeding, because symptoms often appear long before severe anemia develops. Now understand what may be happening underneath. Anemia occurs when the body does not have enough healthy red blood cells or enough hemoglobin to carry oxygen properly. And oxygen affects everything. The brain depends on it. The muscles depend on it. The heart depends on it. So when oxygen delivery gradually falls, the body compensates quietly. The muscles fatigue faster. The brain struggles to focus. The heart works harder to keep up. And over time, symptoms become harder to ignore. Now look at one of the most common patterns we see in young women: heavy menstrual bleeding. Many people normalize very heavy periods for years, but repeated blood loss month after month can slowly reduce iron stores and weaken the body gradually. So the cycle forms. Blood loss leads to lower iron levels. Lower iron levels reduce oxygen delivery. Reduced oxygen delivery worsens fatigue and dizziness. And because the process develops slowly, many people adapt to feeling unwell without realizing the body is under strain. Now step back and look at the system. Nutrition affects blood production. Iron affects oxygen delivery. Sleep affects recovery. Stress affects eating habits and energy levels. Everything is connected. That is why repeated tiredness or dizziness should never be ignored completely, because sometimes the body is signaling that oxygen delivery is struggling to meet daily demands. So think like a nurse at home. Notice how often fatigue appears. Observe dizziness when standing. Pay attention to headaches and palpitations. Track menstrual patterns. Notice changes in stamina and physical activity, because the pattern is the message. Now support the body daily. Maintain regular, balanced meals. Stay hydrated consistently. Prioritize proper rest and sleep. Include iron-rich foods where appropriate. Avoid skipping meals frequently. And do not ignore ongoing heavy menstrual bleeding, because small daily habits strongly affect recovery and energy levels over time. Now know when to seek medical evaluation. Do not delay if you notice severe dizziness or fainting, chest pain, difficulty breathing, rapid worsening fatigue, very heavy menstrual bleeding, recurrent palpitations, extreme weakness, noticeable paleness, difficulty performing normal daily activities. These may indicate significant anemia requiring proper medical assessment. Final point: not every tired person is simply overworked. Not every headache is just stress. And not every episode of dizziness is harmless. Sometimes the body is signaling that oxygen delivery is no longer keeping up with daily needs. So observe the pattern, support healthier routines, and seek evaluation early when symptoms keep repeating, because early attention helps prevent more serious complications. Need guidance? Contact your healthcare provider for proper evaluation or call/WhatsApp plus 233 2087 20347. And remember to explore the other three perspectives because each one completes the picture.